So after the liver, we'll percuss for the spleen. Now, where is the spleen residing? Is it down in the abdomen? It should be up under the ribs, right? So really, in most people, very small, just a very small percentage, but the majority of people, you're not going to be able to percuss the spleen unless there's pathology and it's enlarged. Does that make sense? So you'll expect this to be normal in the absence of pathology in most people, okay? So what we're going to do, we want to come down to the anterior axillary line. We're going to start just a little bit medial to that and work our way down just inferior to the costal margin. So what sound is normal in this area? Hear it? So he's got tympany all the way through. That's what we would expect. Now I'm going to ask the patient to take a deep breath, hold. Good. Same thing, all the way through. Does that make sense? Relax. Now, why did I have him take a deep breath? What happens when you take a deep breath to your diaphragm? Moves inferiorly. What would that do to anything under the diaphragm? Push it inferiorly, right? So if that spleen is enlarged, and let's say we just, even with the first pass, we didn't hear it, that may bring it down enough to hear it. Now, specificity of this is about 80%. So if you hear dullness there, about 80% likely that it is an enlarged spleen. When the spleen enlarges, it tends to come this way. So if it is enlarged, let's say your first pass, you get dullness, then come down this way, work back to see how large it is. Does that make sense? Again, the normal physiological conditions, most of you, hopefully all of you, you won't hear any dullness, it'll just be tympany. Does that make sense? Go down through the anterior axillary line, have them hold their breath, repeat, okay? All right, sit up and face this direction. The last part of percussion is going to be Murphy's kidney punch test. All right, so if you really don't like somebody, here we go. All right, so if you look up there, look, where are the kidneys located? Where do you see them there? You see where the 12th rib connects with the spine? What do we call that angle? Costovertebral angle. So they're right around the costovertebral angle, okay? So on my patient then, I'll find T12 and I'll follow that back up to the spine. And that's where my hand, I'm going to turn this way for the camera, hand here, okay? Normally, I like to do it this way, but this will be fine, right? So costovertebral angle. Now with the fist, I know, with the hypothenar portion, right? Hypothenar portion of the fist, then we're going to apply a little force. So I'm going to tell my patient, you're going to feel a little pressure, and you're going to feel 3 thuds, okay? So he's warned. And then I'm going to strike on top of my fist, or on top of my hands. Does that make sense? I'll start light, medium, and then a little more. Now, I'm not trying to punch through my patient, right? And if I had a big bodybuilder, I would use a little more force than a 75-year-old female. Does that make sense? So think about the patient. We're just trying to cause vibrations. What are we looking for? What's a positive here? It's kidney punch, so we're looking at the kidneys, right? Costovertebral angle. Pain in the kidney. And we use this when we think someone has pyelonephritis or a kidney infection. Okay? Now, with kidney infections, there's costovertebral pain, right? Fever, dysuria, painful urination, positive kidney punch. Does that make sense? Almost always, the week before the patient has had a UTI, that UTI has progressed up, right? Now they've got fever, positive kidney punch signs. They may even have chills, those type of things. Dysuria, discomfort with urination. Does that make sense? All right, so go ahead, percuss for the spleen and perform kidney punch.